session is to explain what happens and what doesn't happen. And of course, the entire intent is to not have a baby. And some of us don't want any more babies. And then, so is the egg released? Is the egg fertilized? Is the embryo not implanted? And then you and your partner can decide at what point, depending on your own cultural religious beliefs, is birth control, if you wish to do birth control, the appropriate type. Obviously, there's side effects of chemicals, hormones that might be involved. There's costs that might be involved with surgeries and so on. There's, is it something you could stop, have a baby, and go back to? So there's a lot of other factors as well. But what I'm focusing on here is, do the egg and the sperm meet? If the egg and the sperm can meet, is implantation allowed? Because each of us has our own, we may not have written it out as a personal belief, but each of us has our own ideas about when does life begin. When would I not be willing to destroy a life without getting into the politics and political correctness of abortion or not having abortion, okay? And so if you believe that life begins as soon as an egg is fertilized by a sperm, then that's a new life, and your beliefs would not allow you to prevent implantation because that would kill that fertilized egg. If you don't believe that a new life begins until the heart starts beating, all right, then you've got a period of about 3 weeks that you could use a chemical abortion. If you go by the legal definition, which is less than 3 months, all right, then you have a greater variety. If you go by, I can't interfere with what is God's plan or what is natural, then abstinence or coitus interruptus or something like that, or none at all. So again, understanding what's happening at each of these will affect, and your beliefs may change, but at least you can understand where and when you might want to affect that whole process. So with each of these components, I'll describe that aspect. The first one talks about behavioral. And this is not having properly trained sperm and obedient eggs, all right, but whether or not you provide them the opportunity to behave properly. So just plain abstinence. That's probably about the only one that has 100% effectiveness. That means not having intercourse, all right? That means not even having ejaculation close to the opening of the vagina, because the sperm have been known to find their ways into the vaginal cavity. Now, I guess you have to take the person's word at it that he ejaculated outside, all right? But if it's on the labia, they can find their way in. So abstinence, coitus interruptus, exactly what it says. So prior to, there's intercourse, but prior to ejaculation, the penis is withdrawn, okay? And again, there may still be ejaculation. There may be, with the emission, if there is a prior ejaculation within the last day or two, within the last 6 hours, and urination hadn't occurred between that time, there might be residual sperm in the urethra. And the emission, remember, is not just the sperm into the urethra, but there's also the seminal vesicular and prostatic secretions. And the emission of the bulbourethral gland, creating lubrication on the surface of the gland's penis, may have some sperm in it. You might say, well, it's not the 20 million per mil that I learned had to be the case, or a guy was infertile. It may be enough. So that's why that one is not going to be complete. And then there's periodic abstinence or the rhythm method. This doesn't work unless you know exactly when ovulation occurs. And just because for the last 10 years it's always occurred on the 14th day of the, after your last cycle, doesn't mean the next period is going to occur on the 14th day. It may occur on the 16th day, or it may occur on the 12th day. So if you've got it along a regular, aspect, periodic abstinence is taking Advantage of the knowledge that the egg is viable for 24 hours, and the sperm, 72, is a given number, but it can be as high as 90 something. And so you would, the longer period of abstinence would be prior to ovulation. So you'll say, okay, I'm not going to have intercourse for 8 days before I ovulate. The sperm can't live that long. And then I'm going to wait for 3 days after I ovulate. So 11 days out of the month, about the time I ovulate, I won't have intercourse. That's the rhythm method, okay? So you might go shorter or longer or whatever, but that's what it's based upon. Again, if your period of time after menses until ovulation is sometimes 10 days and sometimes 3 months, then you're going to be buying boxes and boxes of pregnancy tests because you never really know, all right, using this particular method. On each of these, the egg and the sperm are prevented from meeting. You're not killing the egg, you're not killing the sperm. There are some religious beliefs that don't believe in coitus interruptus, ejaculating outside, spilling the sperm, wasting the sperm. So again, what you do is dependent on your own culture. Yes?
How accurate are those ovulation tests?
They are based, depending on which ones you look at. Almost all of them will include temperature changes, which occur at ovulation, so it's a little too late to stop if you've had intercourse 3 days prior to that, or hormonal levels. They're much better for predicting ovulation, increasing the chance of getting pregnant, than not having intercourse. Because again, most of them are at the time of ovulation, not predicting that you're going to ovulate within 3 days. So looking backwards, so I said to use it to decide when's a good time, the best time, the highest probability of allowing the sperm and the egg to meet to actually create a zygote versus preventing it. Okay, then we have barrier methods. The barrier methods erect a firewall. That sounds painful. Put some type of a barrier between the sperm and the egg. So a male using a condom. A condom is a physical barrier, okay, unless his wife went along and poked holes in it. Or maybe he did. There are female condoms. And there are diaphragms. I've never actually seen a female condom, and I haven't figured out what's the difference between a female condom and a diaphragm. But the diaphragm is a kind of a cup-shaped structure. If you've looked in our plasticized female pelvises, you can look up the vagina. It's been kind of cut slightly and see the cervix. So the female diaphragm is fitted to the woman's cervix, and a thickened rim fits into the fornices. And then there's a cup shape over that that would cover the open and the external os to the cervix. If a woman gains or loses weight or has children, then she needs to be remeasured because those will change and the snugness of the fit will change. And all of these are made more beneficial with the addition of a spermicidal jelly or cream. One of the most common ingredients is known as nonoxynol. You guys know I have no inhibitions when it comes to this unit. So on a personal note, it's the only thing I know of that I'm allergic to. I found out on my honeymoon. So I was teaching in Tennessee. My husband was living in California, and we got married in Maryland. And so he showed up the day before the wedding, and our honeymoon was spent in the Hay Adams, our honeymoon night, we actually honeymooned 3 months later. Our first night of marriage was spent in the Hay Adams Hotel, across from the White House. And we checked into our room, and he said, "So honey, what did you bring for birth control?" I was like, "That's always been your area." He said, "Didn't you bring some condoms?" And he said, "No." Of course, we had, you know, we were living 3,000 miles apart, so it wasn't like we needed this every night. So we got on the Metro, which is the Washington, D.C. BART train, and we rode up and down for an hour looking for drugstores, trying to find some form of birth control. And so we decided to try the sponge, which was discontinued for a while after that, not because of us, but anyway. Today's sponge, different things, and it was a kind of like a small diaphragm, spongy material embedded and penetrated with inoxidil. And next morning when we woke up to catch our flight, I felt like I had the flu. And the next 2 or 3 times that we used it, you had to keep it in for six hours to have an effect, completely guaranteed effect. As soon as I took it out, I immediately felt better. And so I came around to the realization, I don't get along with this stuff. So fast forward, a year and a half later, and I'm giving birth to our first child. And obviously I quit using birth control. And I asked for an epidural. They go in through the back and put an anesthetic outside the dural sac. And I'm sitting on the edge of my bed, wondering how I'm going to deal with contractions and getting a hole poked in my back because I've never had an epidural before. And the anesthesiologist, who came right away, Sutter's really good about that. At least they were 20 years ago. And he's standing behind me and he says, "So, what does minoxidil do?" And I'm like, "What?" He said, "What does minoxidil do?" And I'm going, "It's a spermicide." And I'm trying to figure out why this guy is asking me about a spermicide. I'm about ready to give birth to a baby. Obviously, I wasn't using a spermicide. And so I was kind of a little testy, and I said, "Why are you asking?" And he said, "You put it on your chart that you were allergic to it, and I don't know what it is." So I'm like, "Oh, okay, well, this is what it is." And it just increases the chances that any sperm that do escape from the blockage method will be killed. My sister was using diaphragm and spermicidal jelly, and I told some of you this. She wanted to write a book on how to raise kids, and she didn't have any kids. So she decided she needed to have some, and her husband wasn't quite ready. And so she decided to quit using the diaphragm and only use half the sperm. It came in a tube, and you would, like a syringe, and you would, push it out, and she would only use half of that. And I said, "How does that work?" And she said, "Well, if God wants me to get pregnant, He'll allow the sperm to get through. I've contributed by not using the diaphragm and only half the spermicide." And I was like, "Cheryl," I said, "wouldn't it work a little bit better if you asked God, you and your husband asked God to help you decide when the best time was to have a child, how to develop that knowledge, and then quit using anything?" It's kind of like jumping off a cliff and saying, "Well, if you don't want me to die, God, you're going to send a big bird and I'm going to land on it." Anyway, I don't know what she decided to do, but she had 4 kids every 18 to 22 months. These obviously they kill the sperm, but they don't kill the combined egg and sperm. So ejaculation occurs, the egg is released, they don't meet. All right, so if your belief system is that the egg and the sperm create a new cell, that's not happening here. And then, of course, there wouldn't be any implantation either. All right, chemical methods or hormone methods. Obviously the spermicide isn't chemical, but hormonal methods. We have birth control pills. Actually, they're not birth control pills so much now as they are, there's a great variety. So pills, implants, injections, and so on. These are primarily female. There's a few that they've been trying to develop for the male, but those haven't moved along very, very far. And so what these do, remember, is change the hormonal cycle, and these prevent ovulation. So the sperm can reach all the way out the oviduct and even into the peritoneal cavity, but the egg is not released from the ovary. It stays within the follicles, don't mature, and there isn't ovulation. RU486, we talked about briefly. This is a progesterone blocker. It doesn't do anything about ovulation. So this doesn't even prevent implantation, all right? This results in loss of the implanted embryo and associated tissues. So it's a chemical abortion. It's causing the stratum functionalis by causing progesterone to not be able to bind to the spiral arteries. It results in the beginning of a new menstrual cycle as the stratum functionalis separates from the stratum basalis. So the egg can still join with the sperm and become fertilized. Implantation still occurs, and then it's the implanted tissue and so on that is lost.
So that's a pill?
Not the pill typically is, it's usually 2 pills taken a couple of weeks apart, but it is a pill. Usually when people talk about I'm on the pill, they're talking about birth control pills. Okay. Morning after pills. Or Plan B. Depends on where the woman is in her menstrual cycle. Question?
Why do you have to be 17 to buy that?
Buy the morning after pills? I have no
Is it-
idea
is it
why
any-
laws are such.
Oh, okay,
There were
but
2
it's not-
women that died early on in the RU486 component. I have no idea. I mean, a girl who's 13 can get a medical abortion without any other, I don't know.
Because I was thinking it might have like a side effect because they're not developed.
Yeah,
Some
but
people use it as birth control too, and they shouldn't.
Okay, they
yeah.
like
Taking it.
that's like $53.
Morning after pills are an emergency medication. So, depending where a woman is in her cycle, it will prevent ovulation. Or if she's farther along in her cycle, it will prevent implantation. Okay? It is an emergency type of thing. So a woman who, say, too much drinking and had unprotected sex, or forgot to take her pills, her regular birth control pills. So whatever reason that she thinks that she normally had some sort of birth control, that it failed, this is to take care of that not momentary, but that rare failure. Again, it's not a regular form of birth control. So again, birth control pills, the normal, or implants or whatever, prevent the egg from being ovulated, so the egg and the sperm don't meet. RU486, they meet, they fertilize, implantation occurs, and that is disrupted. Morning after pills may do either prevention of ovulation or prevention of implantation. Okay, they're not to be taken when you're 2.5 months pregnant.
Ugh.
RU486 can be taken that far along.
Ugh.
That's why it's called a chemical abortion. Prevention of implantation. And even this has changed.
You wanted this one? Is that weird?
So the morning after pills can do this if they're taken, depending on the woman's cycle. So they may either prevent ovulation or they may prevent implantation. Intrauterine device. Known as an IUD. For a long time wasn't in use in the United States, still was in Canada, but not in the United States. When my sister, before she went on the spermicide stuff, used an IUD, but she had really heavy periods and a lot of cramping, and so she used that before she had kids, and most of the recommendation down, the practice in Canada, my OBGYN is a Canadian, was they only used it on women who had already had children. The cervix isn't as sensitive. Most IUDs now come coated with hormones. So it's kind of a combination of chemical and prevention of implantation. So the IUD alone, the bare IUD, is usually a copper wire twisted into a T. So the T arms are collapsed. It's inserted into the cervix, and the OBGYN pulls a little string and that pops the arms up towards the oviducts. It's kind of small. And cotton string kind of hangs down into the vagina so the woman can feel for that and make sure it's still in place. Babies have been known to have been born with IUDs embedded in their heads. No other problems. But it's thought that the copper interferes with the implantation, the development of the stratum functionalis. If they are coated with hormones, then that's going to prevent implantation, plus is going to work to prevent ovulation. But the IUD itself interferes with the stratum functionalis preparation. Surgical methods, vasectomy. You guys recognize what a salpingectomy is? Remember what a salpinx, mesosalpinx? That's the uterine tube, so it's another word for tubal ligation. All right, and so those are, again, not going to prevent ovulation. They're not going to prevent the release of the sperm, but they prevent the meeting. So if that's what you're concerned about, their little tubal ligations are often done during right when a woman has just given birth to her child, if she's determined that she already has sufficient children. Sometimes the couple decide to wait and make sure that that baby is healthy. So this can be done intravaginally, or it can be done through short, small incisions with a laparoscope and tools that are used to visualize the pelvic cavity and abdominal cavity, and through small incisions. So it kind of depends on the timing of that. Of course, they shouldn't be done unless they're going to be permanent basis. And then a medical abortion, similar to a chemical abortion, uses surgical instruments. All right, so D&C, dilation, and curettage. The dilation occurs, I don't know what they use now, but back in the 80s they would use a cylinder of seaweed and place it in the cervical canal, and that would cause the cervical wall to soften so that the surgeon or obstetrician could dilate it to get the instruments in. And then essentially the decidua would be scraped off. That's the curettage, meaning cutting. And it's basically a scraper is used to scrape all that tissue off from the stratum basalis. So you would be including the embryo as well. So a similar loss, the same type of tissue would be lost as with the RU486. So this is done chemically to cause the vessels to constrict. The curettage is using a sharp instrument to scrape that off. A D&C is also sometimes used if a woman has abnormal bleeding, to go in and just completely remove any, because sometimes with menses the tissue doesn't, the stratum functionalis doesn't completely separate. And so the uterus can't constrict the vessels and they continue to bleed. So just because you hear that a woman's had a D&C doesn't mean that it was an abortion. Or a D&C may be done after delivery of the baby, when the placenta separates but the rest of the decidua paratalis maybe doesn't separate, and again you have problems with continued bleeding. And so they may go in and do a D&C to complete that separation that didn't occur. Yeah. A miscarriage that wasn't completely, tissue that completely.
That
Right.
would take you up to 3 months.
Mm-hmm.